Pleased to have all of you with us today for another update on some operational issues as well as our ongoing response to the pandemic. I'm joined today by several colleagues to provide some specific updates, and then as is always the case during these webinars, we'll have the chance for some questions and also some celebrations, both equally important. So when we get to the questions component, if you haven't participated in this forum before, I'll give you the instructions. You can ask questions using the Q&A function in the screen at the very bottom. If you could state your name, that would be wonderful. You can raise your hand and ask a question in the participants area as well, and we'll call on you to ask your question live if you'd like to do that. And live questions are always encouraged, so please do. And then at the end, we'll wrap up with some celebrations, and the same format applies. If you'd like to call out someone or a team or a specific initiative or something that you've seen across the organization, you can do that using the live function, or you can type it into the Q&A, and one of us that's moderating will read that out to everyone that's on the webinar today. So without any further ado, let's get started. I'll turn it over to our President and CEO, Rob MacIsaac, who will give us a high-level overview of where we're at, and then some specific updates to follow. So Rob, over to you.
Okay, thanks very much, Aaron, and good morning, everybody. And thanks very much, as always, for tuning into this week's town hall. I think we've got a pretty brief agenda for today, and that really means we'll have lots of time for Q&A afterwards. So if people, as Aaron was saying, would like to engage, that would be great, and we're happy to try to field any of your questions. On behalf of our executive leadership team, I'll say we really value these opportunities to hear from you, to give your insights into things that are top of mind. It helps our team understand, what's important to staff and physicians and areas where maybe we can improve on. So if there's anything you'd like to learn more about or share, please do so. And as always, you can also submit your questions by email to hhsnews@hhsc.ca, and our comms team will make sure to find the right answer for you. So today we're going to hear first from Dr. Barry Lum about our hospital information system renewal project and an exciting internal recruitment campaign that kicked off just yesterday. Then Dave McKeag will provide an update on pandemic pay, something I know that continues to have lots of interest across the enterprise. It's an important topic for lots of you. And then, as always, as Aaron said, Q&A and time for celebrations. So I'll turn it over to Barry Lum for his update.
Thanks, Rob. My comments today will be relatively brief, but I do want to emphasize what you started to say, which is that a notification went out yesterday that we're starting a process for the implementation of our HIS, and this is a tremendous opportunity for individuals working in the institution to take on an entirely new role that we're going to call an application specialist role. Maybe you can go to the next slide, Kelly. So one of the most important pieces of an HIS installation is the work that gets put to bear not at the time that the system goes live, but in the 18 to 24 months leading up to that. The success of an HIS, it really depends on the institution's work in getting ready to go live, and what you get out at the go live time really is entirely dependent on what you put in ahead of time. So in order to do that, we want to recruit up to 90 people, both internally and if necessary externally, to become EPIC superstars and specialists. This would be a full secondment to the EPIC project. Those positions in clinical and other areas will be backfilled. And for those who are interested, you will live, breathe, and work in the EPIC world for the next 2 years to help us get to a successful implementation. It'll be exciting, it'll be fast-paced, it'll be entirely different, and it's a great opportunity for those of you who are looking for something new and for a new challenge. So I would really encourage anybody listening and managers to think about folks that they have in their programs, to encourage folks to apply. The process for review of the applications will take a couple of weeks, and it will involve an interview and a little test with Epic to be sure that you've got the skill set to do it. But please, if you're at all interested, submit your application and let us have a look. Thanks, Rob.
Thanks very much, Barry. So next, maybe I want to pause. Well, no, let's hold for questions till the end. I know we have some about HIS already popping up in the Q&A format, but Dave, maybe we could turn to you for the update on pandemic pay, and then we'll move on from there to our Q&A format.
Hi, thanks, Aaron. So a fairly brief update again. So we've, as you would know, if you were fortunate enough to receive pandemic pay, you have received pandemic pay. So we've begun to process and pay out the hourly payments. That was on an off-cycle payment deliberately. That has been paid. The ongoing process in terms of the lump sum will take a little longer, of course, to be able to do all the math, as well as, especially for any that worked in multiple organizations beyond just HHS, to be able to accumulate the math on the 100 hours. So that process will continue as noted in the FAQs and on the slide. So the next pay for the designated 4-week period is September 15th. So we're very pleased to be moving those dollars out. There's been lots of questions coming in, not surprisingly, from staff around eligibility. Please be patient. Those questions will be answered one by one individually. Thank you for submitting and using the forum to do so. It's important that we do that, but there's been quite a number, as you might guess. So just be patient over the next 2 to 3 weeks as those questions are answered. In many cases, the questions that need to be answered to be able to determine eligibility, if there are specific situations, involves going back and having discussions with the managers. So just be patient while all that occurs. I'd like to again thank the HR and payroll team for facilitating all of that work. The other questions that do continue to seem to pop up is who decided who gets to be paid. And just to reiterate that the government provided a very, very explicit list of eligible positions. You can find that on the government's website. Even there, I would caution, sometimes there are statements that says a certain employee group is eligible, but in behind or in the actual agreements, they're eligible in one sector, but not the hospital sector. So rest assured, our approach has been, if there is eligibility, HHS is paying those positions. That has always been our approach, is to try to start from a position of inclusion and ensure that we can pay everybody under this program that is possible. So I think with that, I'll just pause there and be happy to answer some questions later. But again, thanks to everybody for moving these dollars out to our staff, and thank you, staff, for all the hard work that you continue to do.
Thanks very much, Dave. I know one of the questions ahead of today was about how the list was compiled, which I think you answered. It really is a government list. If someone was curious to, I get it, the devil's in the details in some instances. If someone just wanted a quick assurance, is there a way for them to get that assurance internally at HHS? Like, hey, was I included or not?
Yeah, so again, the list has been followed according to the government. So probably the best thing to do would be to click on the link within the FAQ that will take you to the government's website, which shows eligibility. And if you still have a specific question about yourself that it is unclear, that is the time to reach out through the forum, and the HR team will be happy to help clarify. And again, if it's not listed as eligible, then it wouldn't have been eligible. A lot of the positions in our organization are not, unfortunately.
Gotcha. Thanks very much. Well, I have you in the hot seat too. I know we've been thinking a lot across the organization about the administrative workforce and the return to the workplace planning. We had a memo that went out last week. One of the questions that came up ahead of this call was related to the reimbursement of expenses associated with working from home. I know this is really new for hospitals, but can you talk a bit about the work that's underway in that plan and how we're looking at things like that issue?
Sure, Aaron, thanks. So all of the work around return to work and the planning for that, we're sort of in our minds splitting that into more of a short-term and a longer-term approach. So short-term is it happened. Staff are at home. People ran out the door with their laptops or what have you. And have been making do. And there is a bit of a continued approach in that regard through to the end of the calendar year. We're involved with still ramping up surgeries and preparing for potentially a wave 2 of COVID. So along those lines, it will be a little bit more like status quo, but we'll be asking more questions, understanding staff needs, putting some real stakeholder thought into this, gathering input, and developing what may end up then being a longer term approach, medium to longer term approach. And I know it's a very, very similar approach. We're in constant contact with our peers like, UHN, Sunnybrook, et cetera. And we're all taking a very similar approach in trying to scope out what that needs to be, what that needs to look like for our long-term health of our staff, and always balancing financial realities, of course, as well. But nonetheless, we do understand that a different work environment's a different work environment, and we'll be better positioned in the new year in the calendar year to respond to a question like that.
Thanks a lot, Dave. So more to come.
Sure.
I see
More to come.
Dr. Mertz has joined us. I know from earlier emails, Dominic, you had a time constraint today, and there is a question here in the queue for you. If you don't mind, I'll ask it now, specifically related to, let me see if I get this right, with numbers of COVID cases increasing. We're seeing modest increases province-wide, as well as in the Hamilton area. You participate in the subject matter expert group that's been looking at some of the protocols related to testing for our hospital patients. Can you talk a bit about the potential reinstatement of pre-treatment, pre-op COVID testing, and how are we thinking about these small upticks in incidents in the community?
Yeah, thanks, Aaron. It's a very complex question, and I think the bottom line is we are having an eye on all those metrics pretty much on a daily basis. An uptick, as you say, may be relevant or may not be relevant, depending on what exactly is happening. It's true that we see an increase in case numbers in Hamilton more recently. We are sitting at around 4 new cases per day. We have been as low as 1 to 2 cases per day. That's not a significant increase yet, and it's mostly related to family clusters mostly and other clusters, which suggests that things are still under control and we know where COVID is to the most part. If that changes, we have our policies ready to roll out in case we are at the stage where we no longer consider ourselves to be in a low prevalence setting, and that would include pre-procedural testing, but also changes in terms of when to use N95 in patients with unknown COVID status. It's all ready. We have to turn it on when we realize, okay, now the risk in the community has significantly increased, but we are most definitely not there yet.
Gotcha. Okay. Thank you very much for that answer. Maybe I could switch gears a bit now to HIS. There's a couple of questions about the recent postings. Barry, I could perhaps call on you and maybe with support from Michelle Leroux from HR. Just wondering about those roles. First off, the question, are those unionized roles, or can you talk a bit about the positions and how they're framed?
Yeah, I can start. Maybe Michelle Leroux and or Lafleur can jump in. So the answer is it's a broad spectrum, Aaron, across the organization of folks who we're asking, and some are definitely union positions, and there have been ongoing conversations with the unions. I can't attest to the exact specifics, so I'm going to actually punt to Michelle Lafleur just to make sure that we're absolutely clear on that.
Barry, it's Michelle LaRue, actually. The two Michelles have coordinated, don't you worry. So yes, you're right. We're looking for a diverse group of individuals from across HHS, from various different unions to participate. The roles on the HIS project are non-union. Please, go to the hub. There's a great FAQ up there. There's more to come. As we get these questions, we'll continue to develop that FAQ. More to come on that, but we've worked with our union partners. They've been great. For OPSU, 273, PIPSI, ONA, we've got opportunities for people to transfer outside of the bargaining unit for an extended period of time, up to 28 months, which is great. CUPE up to 24 months, able to retain their seniority during that time, which is wonderful, and really be part of a great project with Michelle and Barry and others. So we're looking forward, already hearing some great excitement. So more to come.
And Michelle, maybe another question that popped up was related to, I guess, the pay for those positions. If I made more in my current role, but wanted to apply for those, would I be slipping into that role if I was the successful candidate, the salary for that new role, or would I be paid at the rate for my current role?
Thanks, Aaron. Good question. So because there's so many unique situations across people's pay, we've really got on the FAQ the link to the non-union total compensation admin policy, and it walks through the specific examples. So we do continue to work with people as they have interest in it, but we're going to rely on that policy to help drive us as we fill these positions. So again, hoping everybody's going to link to the FAQ. If they have questions, of course, they can reach out. At the bottom, it tells you who to contact in HR, and we'll help you work through it.
Gotcha. Maybe one more before you took your video off, but I'm going to call on you again. There was a quick question buried in here about maybe you can answer, maybe you can't. We're happy to follow up with this person after the fact. The next pandemic pay will be paid out very close to a regular payday. Are they being paid out together on the same check, or would they be deposited separately?
I'm going to leave my video on from now on, Aaron. So you if I knew that was the trigger. So you're right. We're sending it to the bank on the 1st, I believe, and the normal deposit date would be the 2nd. So every bank's different. When we push out that pay, different banks pull at different times. So there are people who could see it in their bank as quickly as later that day, sometimes on the 2nd with your normal pay. Could be, it truly depends on credit unions and banks. But that said, it is a separate deposit. You should see it separate and apart. And again, you can always contact HR and we'll help walk you through it. But yes, it is being processed separately from your normal pay.
And I think there's also, as we get ready for the return to school, which is a big deal for a lot of people in our workforce, thinking about making arrangements, and making decisions in that regard. Can you talk a bit about what should people be doing? Should they be speaking to their leader about the need for any flexibility, or how that impacts them personally? And and then maybe I don't know if this traverses into your territory, Dominic, but what should people be thinking about in terms of the increased exposure potential if you had let's say you got 3 kids going back to school? Should I be thinking any differently about my work? So first question about how to look at accommodations, second about infection control.
So I'll start with the accommodations and save the exciting part for Dominic. So actually it is a hot topic. We've received numerous questions about this. So a group has come together, including HR, and we're going to be sending out a communication soon about as school starts. So I would say stay tuned. I don't want to jump ahead of the group that's pulling all this information together. But yes, return to school, I would say if it's not tomorrow, you're going to see something early next week, because we're definitely, I know all of us with children are getting ready and ramping up. But I'll leave that with Dominic now to tell the exciting part, but stay tuned.
Yeah, I think in terms of exposures, the public health rules will prevail. So that means if you are put in self-isolation because you have a kid who may have been exposed to an outbreak in a school setting, you would be expected to stay home. We haven't seen those finalized rules from a public health perspective yet, not yet. So we don't even know at this point whether there's only one case or whether they require 2 cases within the same class to call an outbreak. So there's still a lot of things in the flux there. There's obviously a potential risk that schools may sort of serve as or catalyzing, I would say, what's happening out in the community. So if we see an increase of cases in the community, it's a matter of time and we will see that at schools as well. Should they change anything for the parents at this point? The answer is no, but we need to wait for the public health rules around if your child is symptomatic, is at the school, that's not an outbreak. Our assumption is that not the entire household will be put in self-isolation, and as such, you would be allowed to come to work. This being said, the current rule for public health is if you have a symptomatic household member at home and that's a kid, you need one parent to self-isolate along with that child. So one of the two, say if you have 2 parents at home, one of the 2 will have to self-isolate with the child until you have the negative test back. And this may obviously have implications or would have implications on your availability to come to work. Only once you have a confirmed case in your household, you are in self-isolation for 14 days as per public health rules, which would translate for us into you don't return to work until you're cleared from public health. But again, we will learn more about this in the next week or 2 latest, and we can certainly report back or probably come up with a memo to provide more details on how this will be managed.
Thanks, Dominic. I'm sensing that this might be a topic that's best addressed on our next virtual town hall. I know everybody is trying to keep up with decisions that are being made, and that includes HHS as we work directly with public health and the school boards and think about the implications for our own workforce. So to the question that was in there about is HHS having direct discussions, I can say the answer is yes. But obviously here, as Michelle and Dominic have alluded, there are some things outside our control in terms of the decision-making framework that we'll be in response to, and certainly be able to share more information, hopefully at our next virtual town hall. So we'll make sure that's on the agenda. I have another question in here about about whether a face shield versus a mask. I don't know, maybe Dominic, maybe you give some advice, or one of my other the clinical colleagues here could give some advice. If I had a physician confirmed disability and I needed to wear a face shield versus a mask, how would I confirm my ability to do so or make that arrangement?
So we have had conversation around that at the SME table as well as at the PP task force. We don't consider a face shield per se as a replacement of a medical grade mask, because they don't fit tightly around your mouth, your nose. So there's most likely, I would say, a higher risk of transmission than if you're wearing a mask. With this in mind, we have listed potential options you can use in a setting where, for whatever reason, you're unable to wear a mask. Examples are you're working with someone who's hearing impaired and has to read lips, or certain clinical settings where it's very important to see facial expressions, for example. And then the fallbacks are things like having a plexiglass in between, maintaining distance, face shield is an option there. And there's also clear masks that are now available, which probably don't provide the same protection as a surgical mask would, but certainly adds additional protection. So if you combine that with 2-meter distance, we would consider that as an alternative option. But these are accommodations that can be discussed case by case, and we have that list of potential options for situations like that.
Thanks very much for that response. I do want to take a moment just to acknowledge there was some questions ahead of this virtual town hall that were site-specific in nature, nuanced, in some cases related to specific programs. We've opted to answer those offline, as they don't apply to the larger audience with us today, but rest assured we're working on answers for those. If you did raise that question, we do try to answer every question in turn. So I know there was some others. I just wanted to acknowledge that. I don't see any hands raised right now. We'll maybe give a final call out here for questions. Those that were in the queue have been answered. So final call for questions. As always, if you think of something after the fact, you can always raise it at hhsnews@hhsc.ca, and we'll include it in the next town hall, or we'll get you an answer between now and then. So final call for questions. Any updates, visitor policy? I believe that is something that we're going to look at, Leslie, offline. We had an update for you for that, so you should be getting an email soon. The visitor policy organization-wide applies still. Then Rob, why don't I turn it back to you to lead us through our celebrations a moment, and we'll go from there.
Yeah, so thanks everybody again for all of those questions. I would just encourage folks, if they would like to do any shout outs to anybody in the workplace who has been doing a great job on something, or just generally, now would be a great time to raise it. I would like to do a shout out to everybody on the team who's stepped up and helped either in citywide COVID planning initiatives or in region-wide COVID planning initiatives. HHS has been, really involved across all of HNHB. The former Lynn boundaries, helping to do planning work, not only for what's gone on in the last 6 months, but also in anticipation of what might be happening this fall. So I'm a little bit reticent to call out specific people in case I miss anybody, but for sure, Dr. Stephen Kelly, who's been leading the surgical resumption committee, and Cheryl Williams, who's been co-chairing the Model of Care Regional Committee, Kirsten Kroll and Sharon Pearson, Kelly O'Halloran, who all of whom have been sitting at the City Committee, and lots more beyond that. But all of those people have demanding jobs in the first instance, but to take on those extra responsibilities, I think is really great. Dave McKaig is another one who has been helping out a lot at Ontario Health, in addition to his own responsibilities. So for all of those people who I named, and to everybody else who's done that, it's just really awesome work, and great to see HHS sort of playing a role, well beyond its own walls. So thanks to all of them. Are there others who people would like to shout out to? Pretty quiet group today, Aaron.
Yeah, it's looking that way.
We have a couple.
Leslie, I see you put yourself on video. Why don't I call it? Did you have something on your mind? Nope.
Aaron, you've got a couple hands up.
Oh, I do. Oh, great. Look at that. Okay, here we go. Oh, look they're coming out of the woodwork now. Okay, I've got Sam here with a hand up. Sam, I'm going to hit the unmute button for you, and we'll let her rip. Oh, he disappeared. Okay, I have Ian in the queue. Ian, I'm going to hit the unmute button, and it's over to you.
I just want to reiterate what Rob was saying. Basically, I'm very proud of everybody at HHS, and it makes me very happy to work here.
Awesome.
Hey, Aaron, Sam did a shout out to all the staff who have worked in COVID units or COVID risk units. Absolutely, great shout out.
And I see the logistic and procurement teams there too, who I know did a ton of work, continue to, but for sure at the outset in the global race for supplies for us, which is not abated.
Yeah, I think that's a great shout out. We, when we started off, we, like everybody, were really having to scramble to try to get ourselves into reasonable shape in terms of PPE in particular. Really challenging and nerve-wracking situation, but procurement has done such a great job, and I think we're very well situated today because of how well they've done. Don't want to, take anything for granted about what might happen. So it's still lots of diligence required, but we're in a much better place today with respect to PPE than we were, at the beginning of March.
I see something here from Christy Mohide. Would love to give a shout out to our volunteer association staff and all the cafes, and gift shops who are doing a fantastic job serving all the staff and customers across the site. Thanks for that, Christy, for sure. Any others? Any hands raised?
Aaron, can I raise my hand? It's Michelle.
You sure can.
Thanks. I'd like to make a shout out to our registration teams and information desk teams who have also worked through COVID to welcome patients through these difficult times, through the front end processes while people venture into our doors. So thank you to them.
Awesome. See a couple more here coming in the chat. Rob, did you want to read those?
Yeah, from Leanne, a shout out to all the booking staff who've done a ton of work moving patients back and forth. Absolutely. Thanks from Kaylin. The 800 staff, physicians, and residents who completed the recent HHS communications survey. That's great. So we've gotten that feedback and we'll definitely take it into account as we move forward in getting better at communications. A shout out to the LIS team and HRLMP lab staff for the amazing work they're doing with all of this extra testing. That's a great shout out. Absolutely. The lab has really served us well across the last 6 months.
Absolutely.
Aaron, and just a quick one from me, if you can. Just really wanted to acknowledge the work that's been done by Tanya Roglic and Helene Flagiol, as well as the medical affairs team and Kyle Watts in finance. They've been processing all of the physician compensation pieces that have been coming in. I don't think anyone has an understanding of what an enormous piece of work that is. And on top of all the rest of the busy work they're doing, that group has really been doing a great job in getting that together, and hopefully it'll be submitted in September and those physicians can then be funded for the work that they've done, above and beyond their normal activities. So just want to acknowledge the work they've done. And of course, all the physicians for all the work they did and, have done throughout this whole process.
Thanks, Michael. So Aaron, maybe I'll pass it back to you at this point.
Sounds good. Well, that was a rich and diverse set of celebrations today. Thanks to everybody who took a moment to acknowledge your colleagues or others in the organization and the incredible work that's going on. It continues, and we'll have more to talk about at our next virtual town hall. Please send any questions ahead of time to hhsc at hhs.ca. And I see a couple of notes still. There's a couple of questions that got raised late here. We'll make sure you get an answer, and a couple of shout outs here too for you to read before you part ways. So until our next virtual town hall, thanks to everyone for making time in your day. And until we see you again, stay safe.